Dr. Crosby, yeah, you are an associate professor of medicine, and you have a great experience consulting in hunger strike, and also you've been to Bahrain. I want to ask you a question about hunger strike. In general, what are the different kinds of hunger strike?
Okay. Hunger strikes are a food refusal as a form of protest or grievance against some injustice. And there are different kinds of hunger strikes. What we call a dry hunger strike is if somebody takes no food or no water. These are very rare because people die quickly and they don't have a chance to resolve their grievance. What the most common kind of hunger strike is a person who is refusing food, but often they will take water, and sometimes they will take nutrients and vitamins along with that.
And sugar?
And nutrients would include sugar or carbohydrates. That's correct. And then there are some hunger strikers who refuse food, but they may take in a little more nutrition or just eat periodically. All types of hunger strikes are detrimental to one's health, and even the people who may take a little bit of food will eventually develop the complications of malnutrition, only at a later stage.
I see. Okay. In general, how long could a person on hunger strike live?
That's a good question, and that's going to be variable depending on the person's pre-existing medical conditions, their initial weight, and whether or not they're taking in adequate water and any nutrients or vitamins. What we know is that, at least from the Irish hunger strikers, that people who refuse food and only take fluids or water live between 55 and 75 days. So what we normally say is 2.5 months is about the upper limit that people can live without taking any nutrients, only water.
I see. Let me ask you a question about Mr. Abdulhadi AlKhawajah. He's a Bahraini human rights activist. He has been on hunger strike for about 58 days. The information that we had that at the beginning, he received water, sugar, vitamins, and then recently he stopped taking vitamins and sugar, but just water. So how can you evaluate his medical condition now? And I know you and me, we received some information about his health condition.
I haven't evaluated him directly, or have I received official medical reports, so I can't comment specifically. But from the information that I have received, I am concerned about him. The information says that he's lost 25% of his body weight, and we know that serious medical complications can occur when you lose about 18% of your body weight. So, and those complications can include organ dysfunction, electrolyte disturbances, heart failure, kidney failure, etc. So just based on his body weight alone, I'm concerned about him. I'm also concerned that his blood pressure is low. He looks dehydrated, which means he's not getting enough fluids. But what is most concerning about this report is that he is lethargic and confused. And what that tells me is that he may be developing some vitamin deficiencies, some B vitamin deficiencies, and that can ultimately result in irreversible neurological damage. Mm-hmm. So I am concerned about his health. I think he's now been on a strike for 58 days, and I think his life is in danger.
Mm-hmm. And we have been told that he was sent to military hospitals and he's receiving now IV. Do you think that could help him?
And without more specific information about what kind of care he's getting, it's difficult for me to say. I will say that he absolutely should be in a hospital and possibly even in an intensive care unit. And one thing to be concerned about is that when people have reached this level of malnutrition, when you start to refeed them, it's possible to develop something called the refeeding syndrome. And that can be very life-threatening. What happens is there are rapid shifts in fluids and electrolytes, and heart arrhythmias and heart failure can occur, and people actually die during the process of refeeding. So it is very critical that he is under the care of a qualified physician who is monitoring him appropriately and refeeding him very slowly according to standard protocols. So he is critically ill and will require very expert care.
So based on what you said, he should be examined by qualified, experienced doctors, not just a doctor.
Absolutely. This is very, very specific. This is a very specific medical condition that requires very special skills, and I'm hoping that he's being monitored in an ICU because of he's very ill. So, and the Declaration of Malta would recommend that he also have access to an independent doctor of his choosing to come in and evaluate and to give him advice.
All right. Thank you very much, Dr. Crosby. Thank you.
My pleasure.